Researchers are finding a specific kind of heart disease in COVID-19 survivors. The illness, called myocarditis, is showing up primarily in younger people, and it can cause some serious complications. So for more on this, we are joined by Dr. Haider Warraich. He's a cardiologist and researcher at Brigham and Women's Hospital and Harvard Medical School. Thank you so much for joining us. I have heard a lot about the impact of COVID-19 on the heart, that at times one of the ways in which people succumb to the disease is because they eventually have heart attacks, because it damages small blood vessels. But I have not heard of this myocarditis. What's causing it? What is it?
Myocarditis is simply inflammation of the heart. Myo means heart muscle, and itis, usually anything that ends in itis, means inflammation. So myocarditis is a condition that we've seen before, certainly after other types of viral infection. In rare cases, even people who get influenza or other viruses, in rare cases, will develop inflammation of the heart that can sometimes persist long after the patient may have in fact recovered from the infection otherwise. And over this past year, we've learned a lot about myocarditis and COVID-19. We know that any type of a process that causes inflammation all over the body may in fact cause inflammation of the heart or myocarditis. But we saw some early reports that were showing very high rates of myocarditis in patients who had seemingly recovered from the COVID-19 infection. Certainly at my work in Boston, both at the VA in Boston and at Brigham and Women's, I've had patients I've taken care of myself who have developed fairly severe myocarditis after COVID-19 infection, even after they recovered from the rest of the other syndrome that they initially experienced. What we do know now is that it's probably not as common as was perhaps initially feared, and that's confirmed because of studies that we've done on autopsies and other studies, but it still remains quite serious, and heart failure is one of the most common reasons why patients with COVID-19 who leave the hospital actually end up coming back to it. So it is a serious condition, and we're still learning a lot more about it.
It's good news to hear that it's not as common, but I think what is sort of concerning about this is there are individuals, young people who you think are supposed to be very healthy and would be able to come out of a COVID-19 diagnosis just as fit as they were before, that are finding themselves dealing with this. Example, 26 athletes from Ohio State University with COVID-19 underwent heart testing. Seemingly everything came back normal. But when doctors used a much more expensive test known as a cardiac MRI, nearly half of them showed heart abnormalities, and a portion of them met the criteria for myocarditis. So I don't suppose athletes are particularly susceptible to this, but I am surprised that athletes sort of in peak condition and young would find themselves suffering from this condition.
I think what is very clear is that COVID-19 is a serious infection regardless of how young or old you are. We had recent work that was published in JAMA, Journal of the American Medical Association, which showed that tens of thousands of young Americans have died, in fact, because of COVID-19, and many of them have died because of serious involvement of the heart. What we do know is that if you use an MRI to look for inflammation, that you will find it very, very commonly, much more commonly than if you just rely on other tests. And to me, what that means is that we're still learning more about this illness. We're still learning more about the serious impact it can have on the heart. And we know that there are many athletes who've had very severe, significant myocarditis, at times being unable to play or having to have their careers cut short because of this. So as far as I'm concerned, I know that there's a lot more we need to learn, but with the vaccine around the corner, and in fact, two vaccines now available in the United States, I do feel that we need to give our athletes some more time so that we can understand this illness better before we put them and their bodies at risk.
So, to that point that you just said, just some doctors are recommending that these athletes kind of like hold off on heavy-duty exercise for 3 to 6 months. But my question to you is, what does that mean for just sort of regular people? Most people probably are going to come out of COVID-19. They might feel a little sluggish and they'll just sort of like suffer through it. But should they resume their exercise? If there's a big snowfall, should they head on out there and, start shoveling snow? What do you say?
That's a great question. And I think to that, what I will say is that while we know that most cases of COVID-19 will do get better over time and get better time over matter of weeks, there are people who can have a protracted course of illness. So if you or if your loved one have had COVID-19, and if you're feeling better, for most people that will mean that you'll stay better and you'll be able to get on with your life. But be very, very vigilant. Stay in tune with your body, and if you're ever feeling any symptom that seems to be new or unexplained and that you didn't have before, please let your physician know. I do think, and some of those symptoms that people may want to look for is swelling in the legs or in the belly, being not able to breathe, having some type of chest pain or chest pressure. And when we have seen myocarditis, usually what happens is that people will get better after their initial infection. They will have a period of stability, and then they have symptoms that are much more suggestive of a process that now involves the heart. So again, it is a rare condition, but this is something that we have seen not just in the United States, but in other countries as well. So my advice to people who've had this infection and are recovering from it is that while I reassure them that most people get better, I want them to keep a real close eye on how they feel and don't really test themselves too much. And if they do develop any symptoms that might be concerning or that might be new, please let your physician know, because again, this is an illness that we're still, even though we've come so far, we've made so much tremendous progress in this illness. There's still a lot that we don't know. And the way to figure it out is not by testing yourself, but by really giving your body the best chance at recovering and resting when you don't need to push yourself.
And really quickly, doctor, I know we're talking about one specific disease, a sort of side effect of COVID-19, but if you could tell us quickly about the impact that getting sick with this virus has on the heart, what we've learned so far. I mentioned that it seemed like many people sort of had heart attacks while they were trying to recover from this virus, while they were still battling the virus. Some people have said, well, that's, the COVID-19 deaths are overblown because individuals are actually dying of other things. For example, they're dying of a heart attack. Can you just explain the relationship between COVID-19 and trying to get over that disease and the impact that it has on your heart?
So COVID-19 is an incredibly humbling illness. As a physician, when I've taken care of COVID-19 patients, at times they've gotten better and at times they've had very serious complications, including heart attacks, including heart failure, with even some patients being sick enough to be necessitating evaluation for a heart transplant. COVID-19 can impact the heart through multiple ways. One is through direct injury to the heart itself, but also through the overwhelming inflammation that it essentially ignites in our body. To all the listeners, this is an extremely serious illness. No one is overcounting death or disability from COVID-19. Having been at the bedside of patients who had extremely serious, life-threatening, and at times fatal cardiac complications of COVID-19, and this includes arrhythmias and things or sort of abnormal heart rhythms, or heart attacks, or heart failure. These are all things I've seen during the course of this year. And so my advice to all listeners for your show is that vaccines are here. Please continue to be as vigilant as you can be, because as a physician, this is a humbling disease. Because at times there are many other conditions we have a lot of great therapies for, but we still don't have the same type of therapeutic options we need for this illness. And so the best course of action is really prevention. And now that we know a lot more about preventing COVID-19 than we do about treating some of these serious cardiac complications. So the best way to take care of your heart is to make sure that you don't get this illness in the first place.
Dr. Warraich, those are words literally and figuratively to live by. Thank you so much.
Thank you.